So, Nathan, the next what if that I have for you is what if organizations, large health organizations, had employee addiction advisory panels that were a multidisciplinary team that had employee engagement, that maybe had employees who had already been through the process of the recovery machine, who were then able to act as an advisory panel that provided some checks and balances, that provided some accountability, and that was an ear or a sounding board for concerns or for tweaks and adjustments to this process of the machine that employees have to go through, so that it wasn't just up to a human resources department, wasn't just up to a manager, but there was a specific stationary body that was in place that could hear the concerns and see some common concerns or common threads that were occurring between different cases along the way.
Yeah, that's a brilliant idea. I mean, that it wouldn't even be that hard to implement. And given the rates of the rates everywhere of addiction is a huge problem, and it's not just in certain workplaces, but any workplace where there's access to addictive drugs. Every hospital, you would think, would employ some kind of method like that, just for from a prevention point of view, and again, trying to get efficiency for your money spent for the taxpayer, right? I mean, it wouldn't take, if you had a couple people who, I don't know what kind of hours they would have to commit to that, but eventually you would think that you could get some kind of an entity there that was a third party, it didn't have a vested interest in one, they're not pro-union, they're not pro-HR employer, they're just kind of there strictly as an objective viewer and recorder of what is effective and what is not effective for employees going through these programs. And then you'd pick up some of these things, right? Like you'd say, well, many employers don't know anything about what happens as far as, why are you sending my nurse to Ontario for treatment?
Yeah.
It costs 3 times more than treatment we have in BC. And the program they have there is, it's just like a caduceus group. It's just sometimes it doesn't even exist. Basically, there's no difference really. So, I wonder how many things like that would be kind of caught, right?
Yeah, and with all of the healthcare employees, including yourself, who go out of province, if everyone is coming back and saying, "Look, this specific facility is not serving us well, or it's harmful," then suddenly there could be some accountability there, and a third party who's saying, "We're going to kind of go to bat to see if we can change that."
Yeah. And again, it wouldn't have to be anything more than an objective stance based on we want to do we want the best investment for our money if we're going to send somebody to a facility like that. And we're also investing in our employee. Yeah. So from that point of view, wouldn't you want the best outcome? You'd want your employee back, not necessarily as soon as possible, but as soon as they're ready. And that is an aspect that could be adjusted right there. Sometimes people coming back too soon causes problems. Other times it's way too long and the employee kind of gets lost in the void. So, there's many things that could be at least monitored just get some data there. And then from that data, I would love to see something like that. And I wonder if you could actually attempt to implement that somewhere, just like do a pilot at a small facility or something. Go ahead.
No, it would be fascinating to see it in action. And again, though, a few challenges that come to mind with that. One is the fact that you are dealing with various bodies that have high financial stakes in the process, on every side of it. on the back to work side, on the recovery and addiction side of it, on the employee side of it. There are a lot of drivers there. So that advisory panel, as we're calling it, in the middle would have to really be firmly bolted down and with weather guards in place, because it would get pretty stormy, I would imagine. But I was thinking, for the employee to have another safe, confidential, non-partial body that they can go to for some questions to be answered, or to just say like, hey, is this normal? I just got this phone call and this is how I'm being dealt with by my employer or by whichever body. Is this normal, or should I be expecting something different here? It all comes down to the question too, Nathan, like we've talked about how common is this issue really? And as we're learning, it is quite common, and it is becoming more common. And there are unfortunately, a whole swath of healthcare providers and professionals in the shadows who are yet to kind of have to be processed through the machine that could benefit from having something like that in place.
Yeah. And then there's also the ones who year after year just continue to do what they do, and that's how they work, right?
Yeah.
They don't, nobody notices, or they're in a position where, they've got enough authority or pull or whatever that they can just continue to do what they're doing, and that's it. But it is strange. One of the strangest things about this whole machine entity is that nobody knows about it unless you encounter it. And when you encounter it, you're given no information. It's almost like there's an attempt to, we've talked about it before from a stigma point of view, but I think it's more than that. It's, I don't know. It seems odd that something like that doesn't exist, just from a kind of logistics point of view. But I've never seen anything like that. I've never seen, there was nobody. I searched extensively. I went to both my college and my association looking for somebody I could contact. I just wanted to talk to another pharmacist who'd been through this. Wouldn't do it. Confidentiality. And even when I came back to them after I was through and said, that conversation we had where I was looking for somebody, if you have that happen again, tell them, whoever's in that position I was, they can talk to me. And they said, no, we're not going to do that because
did they give you a reason? Confidentiality.
Confidentiality. I'm like, do I have to sign a waiver? Like, why would you get in the way of that process? I don't know. It's weird.
Well, and as I continue to learn this, on a monthly, if not weekly basis, that every single case seems to be handled a little bit differently. Mm-hmm. And you could attest to that far better than I could, Nathan. But I think that it is in the interest of some of these bodies that it remain behind closed doors, because there's power in that.
There is power. Yeah. It does make it easier from if you're an employer, you definitely probably are pressured to take care of the problem, get it solved, get the liability risk off the table first. And once that's, it would be that initial processing. And so get that person out of the workplace and into treatment so that we can, have some indication on paper that we're protecting the public. I think that's probably their number one, right?
For sure.
But then you have other third parties that have financial interests that may oppose that, like an insurance company, your third party insurance, or whoever's paying for the treatment. If you work for those guys and you're looking at the situation, you're saying, well, these guys keep sending this individual. This is the third time or the second time this individual has been through this process. We're getting a lot of feedback that it's not helping or that they had a negative experience. And yet the employer is not pivoting here. They just continue to go straight down the line at at the same solution that never worked. So that's costing them how much extra money, I don't know. But if I was to try to set something up with a donor, that's who I'd go to first. Yeah. And then immediately you're into problems with conflict of interest. But I think it would have to be, again, either a pooled resource with that involved the entire healthcare system would probably be the best way to go, or you could do it hospital by hospital. What were you thinking for like numbers? Would it be like a kind of a council thing, or would it be a department? Or
I think my initial thought was sort of a council type of thing. That just as you were talking, though, I agree with you that it raises the question of, should it be within the confines of a particular employer? Should the employer have its own advisory board, or should it be larger than that and go back so that it is not employees of that specific organization? So to remove any influence or pull, if there is a manager or director who's sort of saying like, look, we've got to keep this particular policy of sending people out of province for this reason, then that's going to make it very difficult to change anything, and it's going to make it very difficult for repeated concerns to be heard or to enact change. So maybe to take a step back and make it something that employees can go to outside of the walls of their employer, and it might actually increase a feeling of safety and confident. I was going to say confidentiality again there. Yeah, confidentiality away from the employer.
Yeah, you're right. That's a good point to kind of thoroughly think through. And yeah, I when you put it that way, it makes it pretty obvious that you would have to be in a third party, and there wouldn't be any association with the employer. It just could not be. There'd be too many potentials for problems with conflict of interest. But sounds like to me one hell of a job for you, my friend.
Well, it's funny. Like I've told, in telling my story, I've mentioned that there are like 5 different pretty powerful organizations involved, all kind of like pushing and pulling and elbowing their way into the conversation and driving different aspects of it, which is just the reality of it. So then what I'm actually talking about is adding another one, but it would be simply there as a safeguard, as a sounding board, and then as a impartial advocate.
A referee. Yeah. That's what you need. Just to keep it somewhat confined in the bounds of reality, because I think it would eliminate. I mean, there's some decisions that are made that are, I mean, they're straight up just, you look at it, you look at the evidence, you look at the decisions that are being made, and you can't believe that somehow this was the conclusion that whoever was in charge arrived at. But that's, those situations happen, and often it's the decision to put somebody back at work too soon, who maybe, or to put somebody back to work at all when they have no business. Like it's very obvious that they're shaky and they shouldn't be in there. That kind of thing.
Yeah. Or going back to the example in my case of the questionnaire, the infamous questionnaire that I was presented with, where that was, I came forward and told the truth about everything that I had done and been doing. And my employer's answer to that was, well, let's get your doctor to fill out this questionnaire that justifies every single action that you took, with a diagnosis and with a medical explanation, including my ability to choose right from wrong or discern right from wrong. Mm-hmm. It would have been, if there was such a thing as this third party body that we're talking about, this advisory board, that would have been a great thing to bring to them and to say, like, what is this? Can you guys look at this, please? And to get some support on that.
That would be a red flag. Like the ref would throw down the flag, and that would be that human resources guy should have been ejected from the game at that point.
I think so. I mean,
that was so far beyond what anybody with even the smallest amount of common sense or experience would. It's just not the way you'd behave in any kind of civilization,
No.
let alone in a healthcare system that's supposed to be somewhat organized.
No, for sure.
But yeah, excellent idea. And I'm going to think about that a little more.
Yeah, same here.